So now it's actually my pleasure to tell you just a very, very brief bit about the Rhoda G. Sarnat Award. We film these award ceremonies because Rhoda Sarnat is not able to travel to see her award be given. But Rhoda Sarnat is a retired clinical social worker, a former faculty member at the University of Southern California Graduate School of Social Work, and an NASW member who is committed to improving the public perception of professional social work. The Sarnat Award includes a monetary award of $3,000 made possible from the Sarnat Foundation, an endowment fund established in 1966 through a generous gift from Mrs. Sarnat and her spouse, Dr. Bernard Sarnat. I've had the great pleasure of meeting both of them, and it's something, a lasting tribute to the profession that they have established this award. The award is given to an individual, a group, or an organization that has significantly advanced the public image of professional social work. Its purpose is to increase public awareness of and appreciation for the value of social work. Tonight, our award winner, let me just tell you very briefly about him. Most of you know him, I think, quite well. But Mr. Bell has been President and Chief Executive Officer of the Casey Family Program since January 2006. Before that, he served as Casey's Executive Vice President of Child and Family Services for 9 field offices. When retiring President and CEO Ruth Masinga announced his selection as the new President and CEO, she said, "He has the vision, the passion, and the expertise to create partnerships necessary to bring about fundamental changes and improvement to our child welfare system." Prior to joining Casey Family Programs, Mr. Bell served in New York City as Commissioner of the Administration for Children's Services, where he managed a staff of more than 7,000 and a budget of approximately $2.4 billion. New York Mayor Michael Bloomberg called him a gifted administrator, a powerful advocate, and a creative and talented policy maker, instrumental in making ACS the outstanding agency it is today. William Bell has nearly 30 years of experience in the human services field and has spent his entire career working to protect and improve the lives of children and youth in foster care. Throughout his career, he has described himself as a social worker, and he has promoted professional social work and social workers. As his work has taken him from direct service among New York City's most vulnerable children to management of direct service organizations, to leadership at the national policy level, he has continued to use and value his social work skills and to champion the needs of professional social workers. And as that program ended, the one you just saw, when the young woman, the graduate of foster care who has aged out, says, "When someone cares about you who doesn't need to care about you, that's really big." And I think that sums up the way many people feel about William Bell. So we would be delighted if he would come up and receive the International Rhoda G. Sarnat Award.
I'm just saying good evening, and tonight, maybe we need to get a mic check going here before we get started, or I'm going to be humming. We're going to disengage.
This one and do another one.
I'd once learned how to project my voice, but I didn't know that I could also do humming while I was speaking. Thank you, Betsy, and the NASW and NASW Foundation for this honor. I'm deeply humbled by this, and as I sat there listening to the introduction, I was touched that people would say some of those words about me, because for me, all that I'm doing is living the life that I believe that my mother taught me to live. I didn't know that I was going to go there until I stood here, because I'd kind of taken that out of the speech. But my mom passed away in the end of 2005. And from my perspective, she, without the degree, with her fifth grade education, had a level of compassion that has far exceeded anything that I've seen. And even though I went through high school and through college thinking that I was going to be a doctor, and even though in high school I took a college aptitude test that said to me, you are best suited to be a social worker, I discounted that and sought to pursue what I think society has taught us is the place that we should go to practice our craft, where we can have the most impact. But I've come to understand over the course of my life that impact comes from changing people's lives or creating a space for people's lives to change. And that, to me, is social work. To be singled out for something that clearly so many other people have made happen, and that I've been honored to be a part of the kind of changes that have taken place throughout the course of my career is very humbling. But it's, I think, a path that when I found my way to New York City in the early 1980s, having applied to medical school after finishing my undergraduate work and having been turned down for medical school after finishing my undergraduate work, I think something was in the works in saying you should have listened a few years earlier to the indicators. But my first job in New York City was a caseworker, working in a foster care prevention program. And it was there that I began to recognize what I believe is my life's calling. And it's a calling that says that every child in this world, and especially every child in this rich nation we call America, deserves to have the opportunity to be parented effectively, that they deserve to be able to dream. They deserve to be able to explore and experience life uninhibited, so that they can reach their full potential and that they can truly take the bar to the next level for the future generations to come. And that desire is no different than the desire that I have for my own children, two of whom have already crossed that magical landmark of 21, and one who is just about 15 months old. Yeah, I know you're saying you must be out of your mind. But last week here in Seattle, we completed 5 days of an incredible experience with the Dalai Lama and with Archbishop Desmond Tutu. And we spent time over the course of 5 days exploring this notion of compassion and exploring what it really means to express compassion. And as we walked through that, the one thing that kept standing out to me was that compassion is far beyond just a concern for someone else's well-being. But the compassion can never come into existence until you add action to that concern. And for me, it is the life of, and I think the hope of every social worker that says that through my life, through my action, through my giving, through my existence in this world, the world will be made different for those whom I touch. And not only will the world be made different for those who I touch, but it will be made different for those who they touch. Because what I'm giving is life's blood. What I'm giving is an opportunity for people to recognize the inherent quality that exists in all of us, which is to change.